What's it going to be? I think it's going to be open conversation. I think it's going to be me and you hanging out, which is fun. I think it's going to be topics that people need to hear about.
Yeah.
And we obviously have a couple topics that we're ready to kind of roll out.
Give a few.
Mental health, CBD, student athletes. I'm excited. We're going to have fun.
So, we're back here at POSTGRADS The Plat. This is Avery and D.Rey, and we're here with Dr. Michelle Kelly, assistant professor at the Fitzpatrick College of Nursing.
Yes, that's me.
All right, what's going on? So, we brought you on today because we wanted to talk about mental health in athletes, but specifically after injuries, and you know what that means for an athlete after they get injured, and the mental aspect of it. You know, you hear about ACL tears being a 12-month recovery time, or you know, ankle sprains, you're out for 2 weeks, but people don't understand that the mental work that goes into that. So we wanted you to elaborate on that. We'll start off by just talking about your background in nursing, but also athletics with kids.
So I am a pediatric nurse practitioner. So professionally, I've taken care of kids with all sorts of different injuries.
Yes.
But I am also the mom of 3 teenagers, all of who have suffered visible and non-visible injuries. So I think one of the things that is really hard is when you have a kid with a concussion or a stress fracture in their back, their friends don't see a brace on their back or a
crutches or
something that is visible that they can see. Oh, Jackie's hurt, he's got this wrong, or Libby's hurt, she's got this wrong. They just see them sitting on the sidelines and not being able to participate. And the kids, the injured athlete, has to be able to express and explain what's going on. And if that's a 2-week ankle sprain, that's not so hard. But when that becomes a 12-month ACL tear or a 8-week stress fracture in your back, that's a long time to lose part of your identity.
Yes.
And being an athlete, for good or for bad, is really how a lot of kids identify themselves. It's the language that they use, it's how they interact with their friends and their peers.
How much do you think timeline plays a part when maybe there isn't a timeline? Maybe when the athlete's not aware of when they're going to come back. You know, we talked about ACL, which is 12 months, some people quicker, some people longer.
Yeah.
What about those injuries? A concussion probably is along these lines, that there is no timeline. How do you deal with that?
And it's just really hard because the kids, remember, this is the immediacy generation, right?
Sadly.
These kids want an immediate fix.
Yep.
And when you tell them that it's that tincture of time, which is a medical word for as long as it takes, right? That's the treatment, time spent. They don't understand that.
Right.
And that is really hard to accept.
Right.
And as either as a provider or as a parent, it's so frustrating because you can't give them a timeline. You can't say 3 weeks from now, you'll be able to run up and down the court.
Right.
6 weeks from now, you're going to be able to play in a scrimmage, and 12 weeks from now you're going to be able to play in a game.
Right. It gives them something to look forward to.
They need a timeline,
and
you can't give it to them.
Right.
And with something like a concussion, when the symptoms are subjective, right? So as the athlete, I have to be able to tell you that I still have dizziness, or that I still have flashes or headache.
Yeah.
It's really tempting to not tell you that those things are happening.
Right.
And it's really tempting to tell people that I'm okay now and I can go back because I think I should be able to go back.
Right.
So it's this double whammy of nobody can see my symptoms. I'm the only one who can explain it to you. And you think I should be better, and I think I should be better, but I'm not.
Right.
So then they worry even more about what's wrong with them that they're not getting.
Yeah. I think a lot of that can be solved through communication. Like, I think as athletes, a big thing we look for is communication with the doctor, with the coaches, with outside therapy, with whatever it may be, like that solves a lot of those wounds or like confusion around like when I'm coming back or how I handle that. I mean, how do you think your experience was with like communication with your program and like how athletes like responded to those kind of things?
I have to be honest. I agree with you in the sense of there is a bit of a self-imposed pressure to say I want to get back, to not voice your opinion on certain things, and I can definitely say at every level, you know, I'm speaking from the men's side. I'm not exactly sure how all sports work. I'm speaking from the men's side of basketball. There's a huge culture of saying I'm fine when you're not, you know, and not just in the sense of the injury. You know, like for example, with something like an ankle injury, I use that because that's the, you know, the most typical of basketball.
Common.
Exactly.
Yeah.
2 weeks, you know, after 2-3 days, you're like, oh, I'm good. It might be a little swollen, like you got a softball in your leg, but you know, you're gonna try to fight through that. But when you have other injuries, like you said, ones that it really is up to the athlete to say that you feel better or not. Like for me, I had a sternum injury in college, and it was times where I was like, no, I feel a lot better, you know, or I feel a lot worse than what I said that I was. Like, oh no, I'm fine, but I know if something hits me, it's over. Why do you think that is? Why do you think that culture exists of just saying, you know what, I'm gonna get right back into it, knowing you won't?
Well, I think it's twofold, right? Athletes have an outside pressure to perform. College athletes, you're part of the brand. You're part of the enterprise. And when you're sitting on the bench, you're worried about your scholarship. You're worried about who's going to take your spot, right? And the other part of it is, if you've gotten to that level, if you're a high functioning high school athlete or a college athlete, you love the sport and you love what it is that you're doing. So being away from it hurts.
Yes.
And it is challenging, and it makes everything else in your life not as fantastic. And I think it's both sides. I think it's a pressure from within and a pressure from without.
Yeah. I think what you just explained, in my opinion, is identity, right? It's like, and sports becomes part of our identity, and that's put on by outside people, like, oh, Daryl, the basketball player. And that's put on yourself with, this is 15, 20 years of my life by the time you're in college that you've spent on a sport. Like, you're around people that are in that sport, all of your social groups kind of surround, all those things. Your parents look at you as an athlete, and then when that's not there, even with a small injury like like you said, an ankle sprain, like that could take a week. That week that you're not in your sport, it's like, well, what am I doing? Imagine an ACL or something worse, where you're away from the thing that you have identified with all your life. It makes sense why people struggle with it, and I think that's why it's important that we have these conversations and we have people that we bring in, like as a staff, on different programs to help kids with it. For sure, because it's needed, and it's definitely getting better. Is a lot of it based on identity? Is there one common thing that people come to you with when they have mental health issues in terms of athletes?
I think identity is a huge part of it. I think being able to interact with your world is important, and when you lose that main avenue, that's tough. I also think it's the fear of the unknown. Well, what if I'm not going to get back? What if they're not telling me the truth? What if I just worked a little bit harder, I'd get better faster? And there's that piece of the unknown is so scary. A non-timed injury, right? One that just has to get better over time is frightening for athletes. I also think some of it is, the stress of, my day had specific structures. And this is how I got up. I went to practice. I had breakfast with the team. I had study hours with the team. I went to class. Then I have this group that I move from spot to spot with. And now that I'm injured, if you're a college athlete, still moving with that group.
But you're a little isolated.
And are they whispering behind their back, oh, he's dogging it, he should be better by now, and he's not, right? And if they can't get inside your body, there's no objective test that says your sternum still hurts.
Yeah.
Or this, and that's part of it too.
Yeah. Yeah, I think another thing that's important, like injuries, there is that return to play, right? And you have that whole process, which is very hard. But then when you are healthy, right, you get back to the game, and no one comes back from any injury perfect. There's that, whether it's your lungs or your legs are a little wobbly because you're not conditioned. Like, I don't think people understand that when you finally do come back from whatever injury it is, you're still like not fully there as everyone else that's been going around. So do you see a difference in between men and women in how they handle the communication or coming back from injury or just dealing with mental health in general? I know you said you talked about your daughter a little bit.
Oh, yeah.
The spiraling. I don't know if a guy would want to hear you spiraling.
Because girls, I think they, culturally, whether we like to admit it or not, girls have a little more self-doubt, right? Or at least
that self-esteem that we talked about the other day. Yeah.
Self-esteem, right?
Yeah.
And because girls are worried about what they look like as much as how they're performing.
Right.
And
look good, play good.
Yeah. And, there are guys who I know
I was gonna say,
need to look good to play good. I have a son that if it all ain't right, it all ain't right. But they're not as open about it.
Yeah.
So you can look at a female athlete sometimes and go, "Oh, come home, we need to talk." Right? I think the boys might actually be harder.
Yep.
Because they're socialized to keep that solid front and to not let it show.
Right.
And I think parents or coaches, whoever's that person that is close enough to them, needs to knock on the door and needs to say what's really going on with you. Where's your head?
Yeah.
Are you okay?
Yeah.
Sometimes that might fall to roommates, right? I don't know. And in college, I think the roommate is going to be the one that's going to see it fall apart a little bit better, but that roommate has to know that you have to talk to that you have to get them talking.
Yeah.
Or with the player development person or with the coach. I think in high school that falls to parents, right? Or siblings, to look at them and say, when they're in their rooms, when they're in their safe space, where are you?
Right.
Yeah.
Right?
Yeah, our coaches always wanted us to live with athletes, but not on our team, because they felt that would give us a way to kind of separate ourselves from our team and talk to people, like if we are going through something. Do you think schools are doing enough in terms of mental health? I know it's getting better. I've seen it in 5 years that I was at school, from freshman to my grad year. Like, it definitely progressed, but do you think schools are doing enough and taking enough initiative and understanding the importance of it? Or we still got a long way to go?
We still have a huge way to go.
Yeah.
I've lived some of this.